Hi there, welcome back to Mind-Body Relationship, where we talk about the mind, the body, and the relationship. My name is Emerald Hill, and this is Dr. Laurie Ponsford Hill.
Hi Emerald, how are you doing today?
I'm doing really good. I hear that we're actually talking about the body today.
Yes, today we're talking about body pain.
Oh.
Yeah. You know, when I think of body pain, I think of fibromyalgia. So often it is that for whatever reason, we do experience body pain. Even when it's not diagnosed as fibromyalgia.
For sure.
Yeah. When I think about it, I think about, for myself actually, the difference between when it is I eat wheat and when it is that I don't.
Right.
And I never noticed that before until it was that I actually cut wheat out of my diet.
Mm-hmm.
And I had no idea in regards to like hip pain, that sort of thing, that I was actually really experiencing that. And there was actually really a cause to it, which was body inflammation.
Right.
And so by cutting it out, I actually really cut out my body pain at the same time. And it was amazing.
Yeah, I bet it was really great to understand finally why your body was in pain and also the solution to solving it.
So true, right? And the same actually really applied to carbohydrates. Cutting out carbohydrates actually really had the same effect. The difference between a day without carbohydrates and wheat and a day after eating carbohydrates and wheat is a phenomenal difference.
Well, it's interesting that you say that because I find this the same way. When I eat a lot of sugar or carbohydrates, the next day my whole body's lethargic. And it's interesting because you never really apply it with alcohol. Because when I was in college, I discovered that if I drank alcohol that didn't have a lot of sugar in it, I wasn't hungover the next day.
Oh, interesting.
But if I drank alcohol with a lot of sugar in it, can't get out of bed.
Interesting.
Mm-hmm.
Yeah. Well, it's also when you're talking about that too, right? Body pain has a tendency to go along with sleep disturbances.
Oh, right.
Right? And so it has a tendency also to be a combination of the two, because if you're not sleeping very well, then your body is actually really not rejuvenating itself very well at all.
Mm-mm.
Right? And when I think about the times when I'm in pain, whether I have a cold or whatever that is, to try and sleep is a nightmare.
Oh, can't do it.
No.
When you're having cramps or you're sore in your body, it's so difficult to just get yourself to sleep, which is the thing that's going to help you get better.
It's so true.
So frustrating.
It's so frustrating. Well, let's have a look at the different components in regards to fibromyalgia.
Okay.
So some of the symptoms of fibromyalgia. Multiple tender areas in the muscles or joint areas of the back of the neck, shoulders, sternum, lower back, hips, shins, elbows, knees.
Fatigue.
Sleep disturbances.
General body aches.
Reduced exercise tolerance.
Chronic facial muscle pain or aching.
Morning stiffness.
Fatigue.
Vision problems.
Nausea.
Sleep disorders.
Dizziness.
Chronic headaches.
Cold symptoms.
TMJ.
Multiple chemical sensitivity.
Cognitive or memory impairment.
Skin complaints.
Chest symptoms.
Anxiety.
Depression.
Dysmenorrhea. That's a long list.
It is a long list, isn't it? Right? And it can be multiple things. And the truth is, some people are really good at managing their pain, and some people are not really good at managing their pain. Right? So it is really about pain management and what works for you, right? Just thinking about cutting things out, like what we're talking about, changing up the diet actually really has a significant difference. Making sure that you're organizing yourself in regards to getting that sleep that you need is also really important as well.
And understanding the limitations of your body. If you like to go for long walks, maybe think about what it would be like to go for a bit of a shorter walk and how your body responds to that.
Oh, exactly. I mean, it really is about paying attention to your body. Just because one person can go, and do excessive exercising doesn't mean another person has the ability to do that.
No.
No, everybody has their limits.
You hear about personal trainers who say, oh, I have clients who are 100 pounds overweight and they can do the full program that I have for them. And then skinny fat people come in and they can't lift a dumbbell.
That's so funny. There's also something called conversion disorder.
Okay.
Yeah, and conversion disorder is actually when it is that you have emotional or psychological pain and it comes out as a body pain.
Oh, right. Okay.
Mm-hmm. And a lot of the times when people have experienced trauma, then this is a kind of a strategy for managing the trauma.
Oh.
Mm-hmm. So the body is actually really speaking the trauma, but the person isn't in conscious awareness of the trauma emotionally or psychologically.
Interesting.
So, I mean, that's also another component in regards to, paying attention to yourself. Is it actually really the pain that you're experiencing conversion disorder? So it's good to have a look back at your life to be able to determine, well, what are those trauma experiences, things that don't sit with you well, that might actually really being converted within you.
Right. Well, thank you so much, Dr. Laurie, for talking to me about fibromyalgia, and thank you for tuning in. If you have experiences of a physical pain that you were able to identify with an emotional pain, please comment down below. If you like this video, give it a thumbs up, subscribe, stay subscribed, and tune in next time.
Bye for now.
Bye.